And then we have special tests. So each time you're getting farther in here. So once you get to the point where you're actually putting your hands on the patient and doing the special test, you kind of narrowed it down to a smaller area of what you're going to do rather than doing every special test in the book. That wouldn't make sense, right? You want to do one based on the area. And then once you get in here, you get into the special test, and then that's where you're going to get the diagnosis. And because like before you start getting into the special test and doing the range of motion and things, you know, like Aretha said, right? You got to think. So now we're talking about subjective. So basically that's the patient history. That's where you find out what the patient tells you is going on with them. And then there's a different mnemonics you can use. I think most of the time here we talk about old cards, but then there's another older one where the OPQRST, and we'll talk about that. And so then the medical records, like we said, it should be organized, it should cover everything, and it should be reproducible so that you can do it the same thing over and over again. And then as far as when you're talking about insurance and different things like that, if you didn't write it down, you didn't do the test. You know, let's say if you have some malpractice thing, or you have some report you have to submit to insurance, or if you're billing insurance companies, and you bill for a certain code, but there's nothing in your notes that says you wrote it down, that's, you know, that could be considered an insurance fraud. And if you didn't write it down, you just might as well assume that you didn't do it. Right? So you need to document things. Right, so have you heard of this before, the old cards? Okay. So basically it's going to be the onset, and we'll be going over a lot of this stuff here, so you know, you can go over the details of this in your notes. I'm not going to necessarily read off all of these right now, but basically onset. If there was two things that you wanted to ask about if you're doing a history, probably some of the main important things is, was it an acute, was it a sudden specific onset, or is it repetitive? Okay, that's going to divide, like when we talked about these flow charts that I'll show before, it's one of the main things that's going to make the first split. Okay, did you have an acute injury, or was it something that came on over time repetitively? Okay. And then the other thing, and it'll fit in later, is basically, is that pain only in that area, or does it radiate or spread? Right. So then, like I say, this stuff is all in the notes. And then location, basically a lot of times what's easy to do is you're going to use these pain diagrams. So in your paperwork, I think one of the samples of the paperwork I use in my office, I think, was on the secure site. A lot of this stuff you can incorporate into the forms that you're going to use for intake, but in this case, for this class, you need to ask all of that stuff. You can't just, for the midterm, you can't just give the patient a questionnaire for them to fill it out. You have to generate all the questions. So these pain diagrams are good. You can just have the patient locate that, or if you're doing a history on them and they say, is the pain such that you can put one finger and point exactly where it is, or is it more of a diffuse area? And then does it spread? Does it radiate? The duration is how long does it last? And then the characteristics, you want to start about the quality of the pain. In here there's mechanical pain, and then inflammation pain, different types of things. The way the patient describes the pain, that can help you to identify what type of condition it is. And then the A's for aggravating and alleviating, what makes it better, what makes it worse. And then in some cases, people will say the R stands for any related symptoms, or also sometimes they'll talk about radiation. But basically, it's related symptoms. So is there anything else that goes along with it? Any joint, is it joint problem, is there any popping, things like that? Any red flag symptoms? Timing. There's an issue of just straight away, how much of your waking hours do you feel the pain? So usually you can break it down into 4 different groups. 25 or less, 26 to 50, 51 to 75. Or there's also an issue of somebody that only has pain when they do certain things. So it only hurts when I go down the stairs. It only hurts when I run for 10 miles. So the timing can be an issue of just how much time does it occur, or is there certain activities that occur with it? Is it worse in the morning, worse at night, things like that. And then the severity or the intensity, you can use what's called a pain scale, and that's VAS means visual analog scale. Okay. Although I guess maybe pretty soon we might convert it to a digital scale, right? Analog is on the way out. Right? So, and then we'll be showing something on the video here where we talk about the analog, visual analog scale. So basically what you're doing is you're saying to the patient, rate it on a scale of 1 to 10. You know, 1 was the least amount of pain, and 10 was the worst. What kind of number would you give it? Or on the form you can have a line that's, like on my form I have a line that's 10 centimeters long, and you say put a line on this, put a mark on this line to indicate your level of pain. So it's either done with a number or you just rate it on a scale. Because that comes into play where you can compare that to their presenting symptoms and then later on. Because you want to be able to document improvement with treatment. Right? And then there's other things that are done where you have these pain questionnaires, where they fill out a questionnaire and says, you know, I can drive my car as long as I want without pain. So that would be a 0. Then a 1 is I can drive for this amount of time. And basically each question has a level of 1 to 5 where you answer it, and then at the end you add up the total and it gives you a number, and then you can use that again to reassess the patient. Right, so then, like I said, if you're using the old carts, then you still have to add on these other things so that you make sure you don't miss those. Is that, have they had any other treatment for the same type of condition? Or, and these other things as far as imaging, any medications? Let's see, everybody knows what MRI and CT is, right? Magnetic resonance imaging, computerized tomography. How about OTC? Over the counter? Right. So they talk about medications, what kind of exercises they do, and then previous medical history. Have they had that same condition before? And then there's review of symptoms, and then also that's going to be abbreviated as ROS, review of systems. Those are the types of questionnaires that you see where it'll have a section and says, you know, like respiratory things, you have the shortness of breath, you know, things like that. Then it'll have urinary problems, you have your frequency or things like that. It basically goes through the different systems, the skin, integument, skin system, nervous system, respiratory, vascular, things like that. And then the objective is where you're observing. So at first, you're just observing the patient and looking for things like their gait. And these things here is, anybody guess what that is? We're talking about weight bearing? Non-weight bearing, partial weight bearing, full weight bearing. And then you're looking for antalgic gait and posture or movements. You know, if somebody's coming in like this, you know, obviously they've got some type of antalgia, or if they're walking like that. So you want to make sure that you observe for that. Posture, you're going to look for 3 different ways, from the back, from the front, or from either side. You're looking for deformities, and then edema and effusion, erythema, redness, ecchymosis, bruising, scars. So when you're doing like your rhythm or the case study, in the case study you have to mention all these. Just because it wasn't there, but if you don't write it down, we don't know that you didn't look for it. So you say to the patient, there was no signs of swelling, bruising, discoloration, all the things like that. So if you don't write it down, we don't know you didn't do it. And if it's in the midterm or the final, if you don't say it, you didn't do it. Same thing as for records purposes. If you didn't write it down, you didn't do it. So you need to say, okay, I'm looking for this. I'm looking for antalgia, I'm looking for posture, I'm looking for swelling, redness, bruising, all that types of things.